All right, I think all of our panelists are ready for the next presentation. This presentation will be working together in the new era, the Retail Food Safety Regulatory Association Collaborative. Joining us today is Christopher Smith, Director of the Retail Food Protection Branch 3 at the US FDA. We have Dr. David McSwane, Executive Director from the Conference of Food Protection. Dr. Dave Dyjack, Executive Director with the National Environmental Health Association. Elizabeth Nutt, Project Manager at the Association of Food and Drug Officials. Dr. Chelsea Gridley-Smith, the Director of Environmental Health at the National Association of County and City Health Officials. And Dr. Laura Brown, Behavioral Scientist for the Centers of Disease Control and Prevention. Chris, I'll hand it over to you.
Thank you, Tricinda, and good morning, good afternoon to all of you. It is such an honor to be here today to speak with you. So great to see so many familiar names and yeah, just connecting with all of you again. So such an honor to be here today to talk about the Retail Regulatory Association Collaborative and the work we've been doing in partnership with a common goal of advancing retail food safety in this country and reducing the occurrence of foodborne illness risk factors. We have an incredible panel of speakers today that Tricinda just named, representing our 6-member groups of the collaborative. I want to stress that this is not a partnership in name only. We have worked hard at building and strengthening relationships, both at the organizational and individual levels. These partnerships will pay dividends that go far beyond the initiatives you'll hear about today. So let me start by talking about the origins of the collaborative and our alignment with the new era of smarter food safety, which you just heard our Deputy Commissioner Frank Yanis talking about. Go ahead to the next slide, please. These are the 6-member associations and agencies that make up the Regulatory Association Collaborative, which was formed as a way to work cooperatively and leverage resources. In today's presentation, we'll talk about how the collaborative was formed and why it's important to advancing our public health mission. In short, it's about partnership and working together, because we know that we can do so much more collectively than we can individually. Next slide. This statement says it all about the importance of retail food safety and partnership and collaboration. This is from Frank Yanis, who just spoke to us, and I'll read it. In today's modern food system, retail food establishments have emerged as a critical nexus from which consumers now get their food. As this sector plays such a large role in the nation's overall food safety net, it's critical that FDA collaborate with others to adapt and modernize retail food safety approaches with a goal of further protecting consumers. So as I mentioned, this statement says it all to me about the importance of retail food safety and of partnership and collaboration. I'm so excited to see the focus that is being placed on our retail food program. This is exemplified with its prominence within the new era blueprint and also the resources that are being provided through mechanisms such as the Association Collaborative and the Retail Flexible Funding Model. We're so excited to be part of this movement and working with all of you. Regardless of what you do or where you work, everyone owns a piece of retail. We are all stakeholders in retail food protection. Next slide. In the presentation today, we'll start by giving a historical overview of the collaborative and its long-term objectives. We'll talk about how the new era for smarter food safety and how those two initiatives align with each other. After that, the other collaborative members will tell you about some of the exciting projects that we've been working on towards advancing the retail food safety in this new era. Next slide. As you just heard from our Deputy Commissioner, FDA has developed a strategic blueprint, which was literally shaped by thousands of stakeholders who provided input, and that includes many of you. It represents a commitment that FDA makes to the American people to ensure that we have the safest food system in the world. This is an agency-wide initiative that we're so excited to have a large role in for retail. I want to stress that New Era and the Association Collaborative are separate initiatives, but they work in synergy and alignment with each other. Next slide. So we're going to focus on core element 3 of the New Era in this presentation, and that's new business models and retail modernization. 3.1 relates to ensuring food safety of food produced or delivered using new business models. In this presentation, however, we're going to focus and talk a little bit more specifically about 3.2, which is retail modernization, because that's where the primary alignment with the Association Collaborative is focused right now. 3.2 is about modernizing the retail food protection system in this country, what we're doing well, what we need to expand on, where our gaps are, and how we can improve. So this involves looking at the effectiveness of the current system and collaborating with CDC and our associations and our state and our local partners on how better to ensure we can control foodborne illness risk factors at retail. Next slide. So let's talk a little bit about how the Association Collaborative was formed and started working in partnership towards improving and modernizing the retail food safety system in this country. We met originally face-to-face in June of 2019, and you see a picture of that meeting here on the screen. Frank Giannis actually came and spoke to us to start out that meeting. We were seeking ways to work more closely together, leverage our resources. At that meeting, we shared info about how each organization and agency and how we look for commonalities in our priorities. The common goal identified at that meeting is the reduction of foodborne illness at retail, as evidenced by the reduction of foodborne illness risk factors. We spent a lot of time brainstorming what we could do collectively to work towards that goal. We defined several long-term objectives that we could work on together. These objectives were further refined through subsequent meetings of that group, as well as through brainstorming at AFDO's Roadmap to Healthy People 2030 meeting. Next slide. Through all of that, we came up with these 6 major priorities. The first is increasing food code adoption. That includes development of a food code adoption toolkit and national strategy, which you'll hear more about today. Second, we wanted to improve regulatory approach in competency and food safety culture. That includes risk-based inspection methods, root cause analysis, and the use of intervention strategies by regulators. Our third objective was program standards, developing a national strategy to provide a multiplier effect for standards technical assistance. We wanted to develop a way to aid jurisdictions that need assistance the most. FDA, as retail food specialists, do a phenomenal job providing this type of assistance to jurisdictions, but we wanted to look at ways that we can work together to enhance things. The fourth objective was improving outbreak investigations, increasing and improving environmental assessments. This includes identification of contributing factors and environmental antecedents. Fifth, we wanted to increase active managerial control with industry. That includes increasing the use of food safety management systems, increasing the prevalence of trained food handlers and managers, improving hand washing using technology and incentive programs, and promoting the use of intervention strategies used by industry. And finally, we wanted to develop a strategy to enhance communication and better tell our public health story. We wanted to put a face on food safety. That includes issuing joint recommendations on emerging issues and developing ways to easily share information, food safety resources, tools, and best practices. The collaborative members have been working together on projects to gather data, analyze the issues, and putting together materials to address these priority areas. Out of these 6, the 4 that you see marked with a star are the ones that are directly linked to the New Era blueprint. We're so excited to share info with you about the ongoing work on each of these today. So we'll start with Dr. McSwane, who's going to talk to us about the Food Code Adoption Toolkit development.
Thank you very much, Chris, and it's a pleasure to be here and to talk about some information related to the Food Code Adoption Toolkit and how it can be used, where you can find out more information about it, and provide an opportunity for you to provide feedback. As Chris mentioned, the Food Code Adoption Toolkit was created just as one means of facilitating an increased use of food code adoption throughout the United States. The kit itself serves a variety of purposes. It can be used, obviously, as a resource to learn more about the food code and how the food code can be implemented by state, local, territorial, and tribal agencies around the country. It can also be used as a tool to influence decision makers, such as legislators, your health board members, and other individuals in the community who may have influence or a part in the decision-making process for adopting regulations such as the food code, and to use it as the model for which it was intended, both to protect public health within the community and also certainly to enhance retail food safety and accommodations with the industry. The toolkit contains a variety of resources for food safety professionals who are working in both government and industry, and we're going to talk about, at least give you some examples of those as a part of this presentation. One thing I do want to emphasize is that the toolkit is considered to be a living resource, so it will be updated as new tools and new information become available with ultimately our goal of promoting the adoption of the food code. Next slide, please. As Chris mentioned, at least in 4 areas, there's direct linkage between goals and initiatives of the collaborative and the new era deliverables. This slide shows you how our collaborative goal that deals with adoption of a national food code strategy will link up to new deliverable or era deliverable 3.2.3. As you obviously know, there are thousands, literally, of state, local, tribal, and territorial agencies that have responsibility for regulating retail food establishments in the United States. And the food code was developed as the model to provide uniform guidance on food safety rules and regulations for sanitation in retail food establishments. Adoption of recent versions of the food code, we believe, offers a variety of benefits. Obviously, the first and foremost is it hopefully will provide effective controls as a means of reducing the risk of foodborne illnesses in retail food establishments. And secondly, we think it also provides a direct benefit to the industry because they will be able to deal with a uniform set of standards that will apply across both state and local jurisdictions. Next slide, please. Well, as you can see, under the food code adoption strategy, there's sort of 3 key elements. The support that is available and obviously is one of the cornerstones of our early collaborative initiatives. Creation of a food code adoption work group, which was largely responsible for creating the food code toolkit and the kit itself. The food code adoption work group started its process by sending out a survey to 221 state, local, tribal, and territorial jurisdictions to determine how they went about adopting the food code or whatever regulation for retail food safety that they had in place, as well as to identify any challenges and hopefully successes that they enjoyed in the course of adopting that particular regulation. We had 49 of the jurisdictions responded. We believe that probably the low response rate was largely due to COVID because this survey was sent out last year and certainly things were in less than normal situations at that particular point in time. It is anticipated that the survey will be repeated again in the near future, and hopefully we'll have a larger response rate. But of those jurisdictions that did reply, 35% indicated that they had updated their food code effective in 2019, but there was also a range of food codes that were currently in use that ranged from 1999 to 2021. One or two of the agencies indicated that that time they were in the process of updating their food code to the 2017 model, and in anticipation that the 2021 code would be available sometime in the near future. 40% of the jurisdictions indicated it took anywhere from 12 to 24 months to adopt a food code. So consequently, this is a process. It's not something that happens instantly, and it's something that obviously needs to have a lot of support in order for it to happen. The information that was gathered during the survey was used, at least in part, to help develop the information and content that we'll talk about now that relates to the food code adoption toolkit that was created. So if we can have the next slide. This particular slide simply shows or provides really some examples of the kind of information that you can find on the Collaborative's website under the food code adoption toolkit page. There is the summary of the survey that I just mentioned is there. There are also letters of support and testimonials that support adoption of the food code provided by associations, consumer-related associations, academic institutions, as well as industry and governmental agencies. There's educational resources and scholarly articles that promote the adoption of the toolkit, and benefits that are associated with that, as well as some policy statements by national organizations that have an interest in promoting the adoption of the food code adoption toolkit on a national scale. So if we can have the next slide, please. Again, this just summarizes who we think the toolkit will help as a resource. Certainly, we believe food safety professionals working in and with various segments of the retail food industry will find the toolkit to be a valuable resource. Managers and supervisors of food programs, safety programs at local and state level agencies, retail food industry members, quality assurance personnel, anyone who is a decision maker or a policy maker and would be involved in the process that would result in adoption of the food code, as well as legislative bodies. It could be committees that are working with legislative services agencies and others. And then obviously we believe that the membership of each of our collaborative organizations would benefit from this information as well. All right, the next slide, please. Finally, this is just a couple of examples of what we consider to be sort of the longer range activities that will involve the food code adoption initiative and as well as the toolkit. The collaborative food code adoption survey found that there are several sort of key elements when it comes to adoption of the food code. First was that we need to involve industry and other stakeholders and listen to their needs and concerns. We need to be flexible and to modify the food code to fit the needs of our community and its various stakeholder groups, and certainly not to wait long periods of time to update our regulations. That an incremental approach is probably more viable and is better accepted by the industry and those who are among the regulated community. So again, this was simply some of the highlights of the survey that was conducted, and these and other factors are being used to create a targeted approach to food code adoption, which Dr. Dyjack will talk about in a few minutes. Last but not least, I did want to mention that we are looking for input and feedback. The Food Code Work Group would like to know what you think about the Food Code Adoption Toolkit. The link that you see, and if we can have the next slide, the link that you see on this slide will take you to a page where you will be able to provide that kind of feedback, and that we will also like to know if you have suggestions for other resources that should be considered for placement within the toolkit and on the webpage. So with that, I'd like to present next Dr. David Dyjack with the National Environmental Health Association.
Thank you, Dr. McSwane. It's my opinion that the critical and essential role of voluntary standards in the health, safety, and security of Americans, and again, in my opinion, is one of the great untold public health stories in our nation. For those of you that can see me, I have in my hand my razor, and it works and it's safe to use because it's got the UL mark on the back of it, which demonstrates that it is protecting and promoting my health while I shave. In addition, bottled water, there's the NSF mark that assures that there's a process in place to ensure that the water is safe to consume. And for any of you listening in that have renovated your house, there is the NFPA mark, which demonstrates that that product is fireproof and safe for use in your home. The Model Aquatic Health Code, the Food Code play similar roles for us in public health in assuring the public that their health and welfare remains a national strategic priority. So the Targeted Food Code Adoption Project, in my estimation, is not just an academic conversation, but an important one that's central to the health, safety, and security of all Americans. Next slide, please. In that spirit, each association working under the cooperative agreement with the FDA has a role in meeting the collaborative goal of developing a national food code adoption strategy. A major challenge in retail food safety is the lack of uniform adoption of regulations across the US. This creates variation in requirements and standards, spurring inconsistent enforcement of regulations, some which have not been created on current science. Over the next 5 minutes, I will describe NEHA's role in supporting the National Food Code adoption by describing our Targeted Food Code Adoption Project. Next slide, please. NEHA will use, yes, thank you. NEHA will use the Food Code Adoption Toolkit and state-specific research to encourage and assist up to 2 states with adoption of a more recent version of the FDA Model Food Code, recognizing that anything learned from this project can be applied across the country. There are 3 main phases. Our first phase included identification of jurisdictions with older versions of the food code, that is, food codes that are earlier than the 2 most recent versions. Based on those results, we conducted some research on the barriers and challenges that prevented adoption. We began to gather a list of key points of contact from each state. Throughout this phase, we worked with the FDA retail food specialists to identify possible states to work with and to understand their history better to strategize our approach. The identified states, the names of those have not yet been released. The next phase, which we are in now, is to use our research to determine an effective strategy for promoting the food code in specified jurisdictions. And finally, once we have a strategy, we intend to implement it with our partners in the collaborative, working directly with states and its key decision makers and points of contact. We anticipate this project will be in full swing by mid-fall, before the legislative sessions of our targeted states. Next slide, please. The first part of our identification stage was to understand what the landscape of food code adoption looks like. We conducted research to identify state statutes and regulations that adopt all, some, or no portion of the FDA Model Food Code. This map shows a food code adoption years for each state, as well as information on the adopting agency with information on the actual citation to the code that can be found within the laws and the regulations. Next slide. We worked with FDA retail food specialists to research the challenges, barriers, and successes within each target state. We looked at the state's history of adoption of the food code, paying special attention to areas of the code that may have been left out of adoption. We also reviewed past attempts to update the code and sought to identify the barriers that existed to prevent past adoption. In this process, we also identified key decision makers and where the authority lays for adoption of the food code. Not only would we need to identify which agency has authority, but the specific individuals we needed to talk to learn more about the state. We identified state legislatures, specifically those members of health, agriculture, and other state legislative committees involved with food safety that we may wish to reach out to about food code adoption in the 2 states that we're targeting. Additionally, we sought out various associations and consumer groups that may have input in those states. Next slide, please. Next slide, please. This slide demonstrates how the tools and resources in NEHA's targeted approach overlap with the national approach for uniform food code adoption. The Food Code Adoption Toolkit provides many resources such as letters of support, an adoption map, and lists of benefits to the food code adoption, which we heard Dr. McSwane explain. These tools are part of the national approach, but may also be used for our targeted approach. For example, if there is a letter of support from a consumer group based in one of the targeted states, this may be used in our targeted approach. Another part of our national approach, which will be incorporated into our targeted procedures, is the Food Code Adoption Postcard, to be developed in collaboration with the National Conference of State Legislatures. Many of you know this as NCSL. This printed card displays the food code adoption map and a list of adoption benefits. This postcard will be sent to over 1,000 state legislative members involved with food safety before the fall legislative sessions begin. We will use the data we collected from our research in phase 1 of this project to create a targeted letter of support that is specific to the state, including years of adoption, codes and regulations that have not been adopted but should be based on current science, and other information that serves as an informative and persuasive letter to help recipients understand the importance of adoption. We will also be compiling a packet of information for the targeted states that can help the jurisdiction adopt a more recent version of the food code should they elect to do so. Next slide, please. Once we have developed our strategy and gathered the appropriate resources and tools, we will begin to execute our plan. We will make contact with the key decision makers we have identified. We'll also reach out to associations and consumer groups and leverage the resources of state affiliates. Our strategy includes tools and resources that provide information, persuasion, and support to these decision makers. While the ideal outcome of this project is to have full adoption of the most recent version of the food code by targeted states, we will consider this project a success if we learn about and report on the barriers and the challenges that lead to lack of adoption, and the success and best practices that can help other jurisdictions adopt the most current science-based regulations to ensure food safety in their own communities. And my last slide, please. Our work on this project aims to increase uniform adoption of the FDA food code. By targeting up to 2 states, we hope to learn from each state's challenges and barriers and help develop projects that can support specific states in food code adoption. On the horizon is exploring how we can incorporate the food code into a food safety management system approach, which is the topic of Elizabeth's discussion next. Elizabeth?
Thank you, Dr. Dyjack. I'm very excited to be part of this panel, and I've been looking forward to the retail seminar for months now. This nationwide approach is very exciting, so thank you. As Chris Smith mentioned, part of the collaborative objective, it's objective number 5, is to increase the number of food establishments that have a well-developed food safety management system. You can go to the next slide. And this is kind of a repeat of some of the other presenters, but we are working on this project collaboratively. But again, our goal is to increase active managerial control by industry operators. This is kind of an industry-focused objective. And again, we're going to be working with our partners, the Conference for Food Protection, to explore more fully the this whole idea of food safety management system. And I believe Lori Farmer mentioned that there is a food safety management committee that was created out of the recent Conference for Food Protection. So I'm very excited to hear to see what that committee comes up with in collaboration with some of my projects. So So part of what we're doing in this objective is to research the industry to see what do they have in the way of active managerial control, increase those establishments that have food safety management system. Again, we want to align all this work with the new ERA deliverables 3.2.3. We want to help FDA focus some of their discussions with industry as our partners in maybe face-to-face meetings, stakeholder meetings to identify gaps, areas of concern, et cetera. We want to develop hopefully we're going to develop guidance documents, infographics, things of that nature, some tools, resource tools for industry to implement these programs. And of course, we would be sharing this information with the industry partners, the collaborative partners, regulatory partners. Next slide, please. So I'm going to ask you all to go to your Pathable polls, the polls tab. If you're on Pathable, it's next to the chat tab. So if you'll click on that, you're going to see a poll question pop up. And who do you think is most responsible for implementing and driving a food safety management system in a retail food establishment? So I'll give you all a few minutes to get that poll up and vote. And while you're voting, I will go to the next slide. So as we said, food safety begins with a culture. You know, you have to have a food safety management system, you must have a culture. And the culture is the how and what do the food employees think about, or what are they taught about food safety within the establishment? And one of my favorite quotes from Deputy Commissioner Mr. Giannis is, culture is the way we do things around here. Very simply put, if you haven't read any of Mr. Giannis's books, I would recommend the Food Safety Culture book. I hope you can see that, or Food Safety Equals Behavior. I'm not getting any kind of kickback on the promotion of these books, but they're very, very well written. They really break down the whole food safety culture, changing behavior process in a very understandable manner. So those are very good books. I strongly encourage you to read them. So the next slide, please. I'm going to be spending a little bit of time on this particular slide. These are the big projects that we've got going within this particular objective. We are developing a best practices survey. Mr. Mick Miklos with Active Food Safety is my partner in this endeavor. He was formerly with Waffle House and the National Restaurant Association. And Mick contacted the 4 larger food industry associations, the National Restaurant Association, the National Council of Chain Restaurants, the Food Marketing Institute, and the National Association of Convenience Stores. And within those organizations, he solicited participation from some of their leadership, Patrick Guzzle with NRA, John Zimmerman with First Watch, Dan Tu with Yum, Larry Sigler with Waffle House, and Rita Palmer with Papa John's for the national chain of restaurants. And then with the FMI, we had Ms. Hillary Thesmar, Ashley Eisenbeiser, and Michael Roberson with Publix. And then for the National Association of Convenience Stores, Jay Ellingson with Quick Trip, and with the organization, Chris Balsinski. And each organization worked with Mick over a period of time, developing questions, modules, things to survey industry, professional leadership in industry to help us get a handle on where industry is with some of these projects. So the survey was broken into 4 parts: food safety culture, employee health policy, active managerial control, and then also food safety management systems. And we asked many questions in relation to their culture, their training programs, SOPs and what they cover. Do they have programs in place to change their employees' behaviors? Do they have written health policies, and what do they entail? How do they communicate them? How do they communicate to their leadership? We asked specifically about active managerial control. How do they approach risk factors and how do they control the risk factors? Do they have internal and external audit programs to help them? Do they do any monitoring and documentation? And is their policies, do their policies incorporate HACCP-based principles? So it's a very robust survey. We went through many reviews. The reviews for the survey were done in-house by FDA consultants and outside consultants. And the survey is pretty much completed. Mr. Miklos has also solicited 10 members from each one of those organizations to pilot the survey. And we hope to have that survey go out next week as a pilot. And then when we get the results back from the pilot, if we need to make any tweaks, then we would do that. And then probably we're hoping in October through February, we would be distributing the survey out in 4 parts. And then taking that information and, as I said, developing maybe some intervention strategies, some helpful tools and resources for industry to implement food safety management systems within their facilities. The next project we have is an active managerial control course that we are developing for industry food safety professionals. In early August, we convened some food safety regulators, some industry food safety professionals with McDonald's, Cracker Barrel, Casey's Convenience Store, EchoSure, and some, of course, AFDO team members. And we also had the assistance of 2 IFPTI instructional designers. And during this 2-day period, we created a blueprint for the course and it came up with 6 kind of modules that will be fleshed out. But the modules that we came up with in this workshop are the causes for foodborne illness, compliance with food safety requirements, teaching them about the food code, what do they know about the food code, applying the food code, identifying gaps and problem solving, leadership skills, which we think is very important in a food safety management system. Also, food-related emergency leadership. What do you do during an emergency? How do you react to that? What is your response to that? And also record keeping and documentation, which is a very big part of a food safety management system. With each of these modules, we are creating tasks and competencies, and we hope to have that project finalized by the end of the year. We are tentatively thinking about doing it in a virtual format, but also a face-to-face format. So hopefully by the end of the year, early 2022, current situation permitting, we can have some face-to-face meetings, because I think that interaction, that networking is a better atmosphere for learning. So the next slide will be the survey results. And let's see, 77% of you said all of the above, which I think is true. However, I don't know if you all realized that I left off one very important partner to this food safety management system, food culture process, and that is the food safety regulator educator. Because as Mr. Giannis mentioned, it takes all of us to work together to create food safety culture, food safety management systems, which then I believe is the biggest tool that we can have to reduce risk factors and reduce foodborne illness outbreaks. So with that, I will conclude my presentation and turn it over to Ms. Chelsea Gridley-Smith with NACCHO.
Thanks so much, Elizabeth. And recognizing we are coming up on the end of our time together, I'll try to be brief today because I know we still have Laura after me. But it's a pleasure to be with you all today, and it's a wonderful opportunity to speak with you and to talk with you a little bit about some of the work that NACCHO is working on with CFP as part of this collaborative. Next slide, please. So today I'll talk a little bit about NACCHO and CFP's activities to identify, assess, and promote the implementation of effective intervention strategies. This is a goal, of course, that aligns with FDA's New Era Deliverable 3.2.9. Next slide, please. And I want to get into just a little bit of the objective precedent. So effective intervention strategies address a key component of the Food Safety Modernization Act, moving towards preventing food safety problems rather than reacting to them after they occur. To learn more about effective intervention strategies, NACCHO and CFP looked at Standard 9 of the Voluntary National Retail Food Regulatory Program Standards. Conformance to Standard 9 showcases a program's ability to conduct and analyze the data from a risk factor study for the purposes of designing and implementing designing and implementing a study. Further, programs must evaluate the effectiveness of that strategy through a subsequent risk factor study. And in 2018, NACCHO conducted an assessment of the continuous improvement of retail food safety, looking at programs' use of the standards as a tool for fostering continuous improvement. Of those that reported conducting a risk factor study, 81% reported that they also analyzed the data. Of those 81%, only 40% had yet to develop a targeted intervention strategy, leading us to believe that perhaps there's some roadblocks that exist after conducting the risk factor study. So in an effort to identify barriers to developing and implementing targeted intervention strategies, and also strategies to overcome these barriers, NACCHO and CFP developed the following activity. Next slide, please. And again, just through this approach for this activity, we anticipate to generate the listed outputs and outcomes. Outputs include practical approaches to develop and implement intervention strategies, successfully implemented risk factor intervention strategies, and report the findings. The intended outcome is to improve SLTT retail food regulatory programs' knowledge of approaches to implement effective intervention strategies to reduce foodborne illness risk factors. Next slide, please. So the activity includes reviewing, analyzing, and collating retail food risk factor study reports, conducting risk or key informant interviews with sites meeting a set of criteria that includes having verified Standard 9, as well as having conducted one or ideally more than one risk factor study, and then sharing effective intervention strategies. And some themes and questions from the key informant interviews include that the guide looked at asking how identified risk factors were prioritized, what and how were intervention strategies selected and implemented, and were the intervention strategies evaluated for success? Questions also probed for lessons learned in this process and what, if anything, would make the process easier or more streamlined. Next slide, please. So currently we have completed all of our key informant interviews and have begun to code and analyze the data. And similarly, AFDO queried state and territorial programs, and their results are also being analyzed. We will synthesize these together for the final reports. Next slide, please. And finally, our next steps are outlined here, where we're really working to identify these strategies to assist programs to implement effective intervention strategies. And we look forward to sharing the results in the first quarter of 2022. So now I will pass it to Laura Brown with CDC to close this out.
Hi, I'm hoping everybody can hear me.
Yes, we can hear you, Laura.
Great. So I'm with the food safety group at CDC that's focused on supporting food safety regulatory programs and helping them improve food safety. So I'm going to close this out today by briefly discussing why I'm so enthusiastic and optimistic about this collaborative and its future effectiveness. So simply put, the collaborative has the right stuff. It has the right people and the right priorities. Next slide, please. First, the collaborative is composed of the right people. The organizations that make up the collaborative represent the people that are best positioned to impact retail food safety, regulatory retail food program staff, and others that are committed to helping these program staff succeed. CDC's partnered with or funded these organizations on various food safety projects for many years. They have the right expertise, the right commitment, and the right goals to improve retail food safety. And working together like they are through this collaborative should exponentially multiply their impact. Next slide. Second, the collaborative has identified the right priorities, and you've heard about these today, but success in meeting these priorities will lead to improved retail food safety. And CDC has been or is currently engaged in a number of projects related to these priorities. So what I'm going to do is just present again very briefly on 2 of these projects, the results of which demonstrate the relationship between these activities, these priorities, and food safety. Next slide. Recent CDC research has shown a positive link between state adoption of specific food code provisions and foodborne outbreaks. So you'll see here that we found that states that adopted the FDA food code provision of prohibiting bare hand contact had fewer norovirus outbreaks than states that had not adopted this provision. And here's a graphical representation of that. You'll see the states that had adopted the provision had 0.5 norovirus outbreaks per million person years compared to 0.7 for states without that provision. And you see a similar effect with the provision of requiring kitchen manager certification. States with the provision requiring that certification had fewer norovirus outbreaks than states without that provision. Now, these data are not about adoption of the food code as a whole, but about specific provisions. But we do see that they demonstrate the impact of food code adoption on food safety. Next slide. So the next priority I'll talk about is food safety management systems. CDC research has also found some findings on the potential of food safety management systems to improve food safety. So this research shows that restaurants that provide staff food safety training, which is a key component of a good food safety management system, have smaller norovirus outbreaks than restaurants that don't provide this training. So if you'll see on the left-hand side of this slide, you'll see that the average size of norovirus outbreaks in restaurants that don't provide any staff food safety training is 28, so 28 sick people. If you go down all the way to the right on the slides, you'll see that the average size of a norovirus outbreaks for restaurants that provide 2 types of training on the job and classroom is significantly smaller. It's an average of 11 ill people per outbreak. Now, again, these data cover only one component of food safety management systems, the training component. But again, these data point to the impact, the potential impact of improving food safety management systems as a whole on food safety. Next slide. So to sum up, the collaborative has the right people, the right organizations, and the right priorities to really move the needle on food safety. CDC is really excited about the future of the collaborative, and we're confident in its ability to succeed. Next slide. Thank you so much.
Thank you, collaborative. What a great job. Unfortunately, we do not have time to answer any questions today, but the chat will be saved and the speakers can follow up with the responses to the questions that did not get answered today. We are going to take a 5-minute break